Hello, I'm Dr. Alex Duarte. I hold a PhD in nutrition. I was an eye doctor and optometrist for years. We consume 600 million Big Macs every year, 20 billion hot dogs, 8 billion chickens. You can soon realize why we have one-third of our population that's obese. We have 62% of our adult population that's overweight. And we have over 1 million cardiovascular deaths every year, over 500,000 cancer deaths, and believe it or not, 8% of our population has diabetes. So based on what we are consuming, we begin to realize the consequences in terms of these diseases that most of us are dying from. Now, if you look at the recommended daily allowances and then the new DRIs that are proposed by the government in terms of the levels of nutrients, we soon begin to realize that these levels do not address specific problems that we face in reality. For instance, I don't know if you're aware of this, but a tremendous number of people in our society take medication. Well, these RDAs don't address the level of nutrients that are being wasted by medications.
Hello, I'm Stephen Horn. In our modern society, we are faced with the most stressful society that any group of people have ever lived in. We have a declining problem with nutrition because of the problem of highly processed foods that are loaded with chemicals. We also have more chemicals in our environment than have ever been in the history of the planet. There's some 50,000 chemicals that are released into the environment every year. In fact, there's approximately 1 ton of garbage produced for every human being on this planet every week. And this combination of the toxicity, the lack of nutrients, the depletion of our soils, the high stress level that we have, are creating chronic and degenerative diseases that are coming and hitting people at younger and younger ages. The medical answer to this is basically oriented around treating symptoms. And our society waits until we're sick to try to treat the disease and then treats it by trying to do something that basically covers up the symptoms without looking at the cause.
For more information on this topic, please contact the person who sent this information to you.